It's been over 365 days since Lonzo Ball has been on the basketball court, and the most recent news that he's being shut down for the rest of the season understandably has NBA fans very concerned. Welcome back, everybody. I'm Dr. Brian Sutterer, and if you're new here and enjoy learning about anatomy and the mechanisms of different sports injuries, then please consider subscribing to stay up to date with all my future videos. It's never good to hear that someone's injury is so unique that a number of different doctors around the country have never seen it before, and that's the news that we heard today from Ball's agent. An important distinction here, though, is the difference between whether or not doctors have a diagnosis, they've just never seen it before, versus not having a diagnosis and not understanding why he's having continued pain. Even if your diagnosis is extremely rare, you at least know what it is and you can formulate some sort of timeline and treatment plan, which is why I'm concerned that this is more of the latter, where basically doctors have no idea why Lonzo is continuing to experience pain. All of this began back in January of 2022 after Ball sustained a bone bruise and a meniscus tear in his knee. Now, of course, this is the same knee that back in 2018, Lonzo underwent surgery for his meniscus, so there was already some existing injury, something that had to be treated on the meniscus before. If you look at our biodigital anatomy tool here, I've highlighted the main structures we'll talk about with the knee as we walk through this whole saga. In the front here, we're going to have the patella, but let's hide that and get out of the way until we come back to it later on. Of course, the menisci are these two little cushion shock-absorbing pads kind of cartilage that help to stabilize the knee. They help to distribute the forces from the contour of the femur evenly throughout the tibia. Back in the day when people had meniscus tears a long time ago, we thought the meniscus was just this vestigial structure, and so sometimes when it was torn, doctors would just cut out and remove the entire thing. If we think of just the flat contour of our tibia, when the femur is rounded and makes contact, there's one little tiny focus of where that force is being loaded. But when we have a meniscus sitting inside here, what that does is it increases the surface area around which the femur is contacting through the joint. And so you distribute that force through a greater area, which ultimately decreases the pressure. This is why we need a good, healthy meniscus in our knee. The original timeline of 6 to 8 weeks suggests that the surgery was just to go in and basically shave out or debride the meniscus tear that was found on his imaging. That's all fine and dandy, but the problem is if you do this too many times, you can eventually take away so much of the meniscus that you start to lose the meniscus's biomechanical properties that help it function in the knee and help to distribute those loads. There's some point between taking out just a small amount of the meniscus and taking out the entire thing where you cross a threshold where you alter the forces through the knee and potentially lead to more problems. But at least in the short term, it tends to offer good resolution in pain. And so an NBA player who needs to get back out on the court, it's something that we often see done. So question number one, when I look back at all this and try to find where little things might be different or what might have happened, is to ask whether or not the meniscus tear was in fact the cause of his pain. This might sound crazy, but in a lot of NBA players, if you get an MRI of their knee, we're probably going to see some degree of degenerative, irritated meniscus pathology. That doesn't mean that it's necessarily causing symptoms. And so sometimes you can get stuck in this situation where you see something abnormal on the MRI scan and you're trying to piece together if that fits clinically. So point number one that I would just consider with this whole situation is, was it in fact the meniscus tear that was causing the initial problem? As we moved on through this whole sequence, of course, there was a bone bruise that was present, and we've seen the impact that a significant bone bruise can have on a player with what just recently happened with Kendrick Nunn. The bone bruise is typically something that just requires rest. You have to take weight off of the knee and then gradually load it back up to allow those cells within the bone to heal and recover. Unfortunately, towards the end of March was when the Bulls said they were going to pull back on Ball's rehab process, which pushed him past that initial timeline. Then shortly, just a couple weeks later, in early April, they ruled him out for the rest of the season. Y'all know what happened next. Ball was supposed to be ready at the start of the season, but had to undergo another arthroscopic procedure to again treat what doctors believe to be the cause of the persistent pain within his knee. The second procedure was just an arthroscopic debridement, basically another procedure where they go in, clean up the cartilage a little bit, try to smooth things out, remove any loose bodies that are floating around, and basically just clean out the knee. This is again something that sometimes can only offer short-term benefit, especially when there's more extensive damage within the knee. You might feel pretty good eventually to get out some of that debris, get out some of that irritating tissue, but then as you try to ramp things back up, the things that were causing pain are still present and lead to more setbacks. One weird part of this that I don't quite understand is at one point LeVar Ball said that the procedure was done to remove some bone spurs that were pinching on a nerve. The confusing part about that is there aren't any nerves inside the knee. Now, unless somebody has extremely unusual altered anatomy that would be very uncommon, the main nerves that we talk about around the knee that supply the majority of strength and sensory innervation are going to be the common peroneal nerve, which runs on the outside of the knee and then down the outside of the leg, or the tibial nerve, which runs along the backside of the knee and the popliteal fossa. These are two nerve structures that shouldn't really be anywhere near somebody who's getting just meniscus trim or debridement inside the knee. Now, sometimes when a meniscus is repaired, meaning there's sutures that are looped through the meniscus to sew it back up, the sutures are actually passed sometimes on the outside of the knee. And so occasionally you can actually sort of lasso or hit this peroneal nerve on the outside with your sutures as you're trying to get them in and out of the joint to stitch that meniscus together. But again, it doesn't seem like at any point along this way, Lonzo had a knee meniscus repair that would put this nerve at risk of getting hit or blocked by a suture. So I'm not sure where that comment about the nerve being pinched by bone spurs came from with LeVar. That's something I've personally never really seen or heard of, and I don't know if that was just something lost in translation or what was really going on. It certainly is possible that Ball has bone spurs or little loose bodies in his knee that were removed with the surgery, but again, I don't know how that is necessarily pinching on at least any of the main nerves that we see throughout the knee. We're basically at this point where Ball has persistent pain in his knee. The bigger concern is the doctors seem to not have any idea why he has pain. In those cases, if a patient like that comes to me, we have to really start thinking outside of the box and thinking about things that don't structurally show up as abnormal on any sort of imaging study. Number one thing to think outside of the box is evaluating the joints above and below. Evaluate the hip joint really well and evaluate the ankle joint really well. Pain can be referred, especially from the hip joint, down to the knee. And so even though there might have been a true meniscus tear present, it's very possible that Ball has some sort of pathology in his hip that's referring pain down to his knee. And when the doctors look at the knee, everything looks okay if they haven't yet assessed his hip. Then I think about things where there might be pain, but nothing structurally abnormal on the MRI. One such thing is something very commonly seen in young athletes called patellofemoral pain syndrome. I pointed out the patella, the kneecap, earlier, and the patella basically slides back and forth in this groove of the femur called the trochlea. Because of muscle imbalance, usually from weak hip abductor muscles and poor knee control, you can have increased force through this patellofemoral joint that causes pain. Especially when I heard about Ball having pain going up and down stairs, this was the first thing I thought of because that's often the main complaint when people have patellofemoral pain. And patellofemoral pain is not something that shows up abnormal on MRI. It's something that you have, your x-rays look normal, your MRI usually looks normal, but you still have pain for what we think is how the kneecap is being loaded abnormally behind onto the trochlea. One way to help tease some of this out is with diagnostic injections with just numbing medicine. Basically put numbing medicine inside the knee joint and see if it takes away his pain. If it takes the pain away, then we at least can narrow down the source of the problem to inside the knee joint, whether that's the patellofemoral joint, whether that's the meniscus, the cartilage. A diagnostic numbing medicine only injection would be extremely helpful to just tease out, is this intra or extra articular? Then you can narrow your focus more. If it does absolutely nothing to help his pain, then you have to start looking extra articular or think about those biomechanics things. Think about the hip, think about the ankle. The other thing to keep in mind is just the longer that time goes on, the more you start to worry about how time away from basketball and just the loss of that sort of motor programming between the brain and the body can have an effect on people's pain and function. We all saw what Markelle Fultz underwent recently, where he was out of basketball for a really, really long time. And a lot of it seemed to be related to just this muscle programming and his ability to kind of remember his form and how to move and act in the basketball court. These elite athletes operate at such a fine line of skill that the smallest little thing that throws that off can have more significant implications than what it might just for you and I going about our normal daily life. It's always interesting to think about what I would personally do if someone like this was in my office, and obviously you'd have access to medical records and a better sense of what diagnostic tests showed, exactly what surgeries were done. But my first step would probably be to do a diagnostic injection to try and rule out if it's intra-articular or extra-articular. Look at the hip. The next decision point that's really hard though is for some of these conditions, you need to shut people down and rest them. And for other conditions, you need to strengthen them. You need to move, whether it's patellar tendonitis, quadriceps tendonitis, patellofemoral pain. Some of these other things actually require load. And so if all you do is shut somebody down and rest them, you don't make any progress. I will say though, what doesn't tend to help in these circumstances when there's not a clear diagnosis is going in and just doing more of these knee scopes, knee debridements, because again, people feel really good immediately because you've kind of cleaned things up, you've trimmed it out, you've kind of smoothed the areas. But then months later, the root of the problem was still there and things just tend to come back. If this video sounds a little bit rambly and all over the place, it's because this is a really complex, challenging circumstance. It's part of why I hadn't made a video on it until we just got today's news, because you really don't know exactly what's been done. There are so many other areas of possible pathology in the knee, things we've never talked about on this channel, that somebody can have that are much more challenging to treat. We don't specifically know how Lonzo might have some anatomic variation in his structure that makes all of this much more complicated, because I guarantee you those things exist. And while they're rare, NBA players are just as likely to potentially have those variations as anybody else. Sports medicine is often a lot more complex than how it's portrayed to us on TV, or even how I often present it in these videos, because if you get lost in those weeds, it just becomes too overwhelming. But the reality day to day is a lot of times this stuff is very nuanced and very detailed. Finally, to finish up here, people will ask in the comments to talk about, is this career ending? Is Lonzo's career over? And honestly, I have no way to predict that or really give you a good sense. Of course, we all remember the stories of people like Brandon Roy, who seemingly just were going to undergo another knee surgery, things were going to be okay, and then before he knew it, they were out of the league. Remember, we don't really know the full extent of what these players' joints look like. We don't know the full extent of maybe what they had done when they were younger before they got into the league. We don't know exactly how significant their cartilage loss may or may not be, or their meniscus tearing may or may not be. We really don't have any clear sense of where on the spectrum these players might fall, and oftentimes those are the things that can make that difference of whether or not somebody's career will continue long-term, or they'll have the longevity of someone like LeBron James. And we'll never know it for a lot of these guys, Lonzo included. And so I think at this point, all we can do is, number one, hope that Lonzo can just get back to daily life and not have pain with normal daily living activities. If we get into the summer and we're still not seeing signs of ramp up, we're still seeing confusion, more surgeries that hopefully will fix the problem, then yeah, I'd be concerned about next season and long term. But I think we are still in a window where we've got a time period where he can shut things down, hopefully ramp back up a little bit, and maybe get back in time for next season before we start being too doom and gloom about his career being over. That's it for the video, everybody. I hope this was helpful. Again, sorry if it was a little bit all over the place, but I wanted to give you just kind of my free-flowing thoughts about this whole situation and kind of talk through some of the things that at least I would think about when an athlete like this was in my clinic under these types of circumstances. Let me know as always any questions or comments down below. And until next time, we'll see you later.